Dr. Whitworth.
Great.
Whitwell, sorry.
Great,
Whitwell.
thank you. Thank you. So I'm going to talk to you about neuroimaging today, and what I'm hoping to do is to explain to you why patients with PSP undergo neuroimaging, what are we looking for, and what are we learning as we're looking at neuroimaging studies in PSP and CBD. So what's the role of neuroimaging? Well, first of all, a clinician will perform some neuroimaging, typically an MR scan, to exclude potentially treatable causes, if there's a tumour or anything else in the brain that might be explaining the symptoms. But then further on from that, when we're looking at disease, the value is really threefold. One is to help with diagnosis, if we can see something on the scan that can help corroborate the clinical diagnosis. To track progression of the disease, because we can perform MR scans annually, we can perform multiple MR scans, and it's safe to do so. So we can look at how the disease or the brain is changing over time. And actually we have so many different scans available now that it can help us to understand disease mechanisms. So what's the biology underlying the disease, and how is that changing over time, and how do these different aspects of the disease relate to each other? So we're actually learning a lot from brain imaging. So what can we measure? Well, the three types of scans that I'm going to talk to you about today, the first will be the MRI scan. So we look at the MRI scan to look at the structure of the brain, and here we're looking for typically shrinkage of the brain, so loss of brain tissue. We can also perform an FDG PET scan that you saw some images of from Dr. Bavet's talk. Here we're looking at brain metabolism. We're looking at how well the tissue that's there is using up glucose and energy in the brain, so how well is it performing? And we also now have the ability to look at specific proteins like the tau protein in the brain using PET imaging, which is a very exciting advance. So I'll start by looking at the imaging that really allows us to look at neurodegeneration, so the MR and the FDG PET scans. So first of all, we'll look at some of the characteristics and features of PSP, and you've seen some of these on previous presentations, but before I go into that, I just wanted to orient you on the brain. So here I'm showing a 3D rendering of a brain. So here is a side view of the brain, so it's as if you're looking through this patient from the side. This is the front of the brain, and we call this the frontal lobe. Then this view here is a top view on the brain, as if you're looking straight down on top of somebody's head. And this is the front of the brain, and this is the back of the brain. And then if we see this red line here, if we were to sort of split open the brain down this midline and then look to the middle surface, it would look like this. So this is sort of a middle cut through the brain, and this is when you see your brainstem coming in. You've heard a lot about the midbrain, and the midbrain sits right here on top of this brainstem structure that leads up into the rest of the brain. Some other structures that I might mention, this is called the cerebellum down here. And the rest of the brain up here we kind of refer to as the cortex. So you've got the brainstem, cerebellum, and the cortex of the brain. And then the image next to it is actually an MR scan, a slice that about the same position as this rendering that I've shown you. And again, here is the brainstem, and here is this midbrain that you've been learning about. So you've already heard, I think multiple times today, that we see midbrain atrophy in PSP. So that's shrinkage of this midbrain structure. And here it is. So this is 3 brain stems, which are here in the brain, from control subjects. And you can see how big this midbrain structure is. And this is brain scans from 3 patients with PSP. I should try to point to both sides here. So you can see we've lost width and height of this midbrain structure. And it also starts to resemble a hummingbird. It's often called the hummingbird sign because you get a little, sort of almost a beak come up, and you've got a big chest here, which is a structure called the pons. So it can be called a hummingbird sign or a penguin sign. And it's very characteristic for PSP. So we can do measurements of this structure. We can get an MRI scan, and we can measure around this midbrain. We can get an area, just do a little outline of it, and I'll show a picture, or get the whole volume of this structure. And when you do that, and this is an area measurement in a group of patients with PSP and a group of controls, you see really good separation between the two, between PSP, who have small midbrain areas, and controls that have large midbrain areas. So it can be very useful in diagnosis if you see that sign on the MR scan. And we've also done some work looking at how imaging might be helpful to predict what might happen to a patient over time. And we found that patients that have, get my pointer back, smaller midbrain volumes, they tend to decline faster in the subsequent years, the following years, than patients that have a larger midbrain volume. So it could be helpful to help the clinician sort of get a guess about the rate of subsequent progression. And it's probably because if the midbrain's smaller, we're capturing patients at a later stage of the disease. So you've heard about the midbrain, but there's also another characteristic feature that we can see on an MR scan in PSP. So here I'm showing a slice right here through the brain. So this red line kind of orients you where I'm looking in the brain. So you've got these cerebellar structures here, and it goes back through the back part of the brain. And we actually see shrinkage of little structures here compared to the controls. And these are called the superior cerebellar peduncles. So you don't really particularly need to remember the name, but you can just see the shrinkage here of these two little, and these are little tracts that take information from the cerebellum up to the rest of the brain. And we see shrinkage right here in patients with PSP. And we've looked a little bit, we've taken measurements from these tracts, from these superior cerebellar peduncle tracts, and we find that integrity or the size of these superior cerebellar peduncle, the little tracts, correlates well with clinical disease severity, and that's measured on the PSP rating scale that Dr. Beauvais mentioned. So the smaller these structures, the worse the patients generally perform clinically. So it really seems to relate quite strongly to the clinical presentation in PSP. So we can also use these two characteristics, the midbrain and the superior cerebellar peduncle, to aid in diagnosis. So a lot of studies have been done measuring these structures in the brain. So here, this just shows how you can measure the area of the midbrain, and you can also measure the area of this region just underneath it, which is called the pons. And we can do little line measurements here of the superior cerebellar peduncles. I'll show it both sides, the line and the area measurements here. And you can look at different combinations of these different measurements, and studies have shown that if you do that, these measurements perform pretty well. You can differentiate patients that have a PSP from patients that have Parkinson's disease almost entirely in a number of studies. And you could also differentiate patients with PSP from patients with MSA. What we don't know, and there really hasn't been a lot of work looking at it, is how well we can differentiate patients with PSP from patients with Corticobasal syndrome. So those were two specific things that we look at on the MR scan. But we've also done studies that allow us to look through the rest of the brain. What's happening at the rest of the brain and not just these two little structures? So to explain that to you, I just wanted to very briefly talk about two different types of brain tissue. So this is a slice through the brain, an MR scan, and again I've shown you a red line to show roughly where I'm looking in the brain. You see the cerebellum's down here. And you can see two different colours in the brain scan. So the bit around the edge here, that I've actually highlighted in red, is grey on the MR scan, and it's called the grey matter of the brain. And then the lighter grey on the inside here is called the white matter. Now, the white matter consists of basically a load of tracks that connect different parts of the grey matter, and I've shown those here. And these tracks send information from one part of the brain to another. It's kind of how the brain, different parts of the brain talks to itself through these tracks. So there's the grey matter around the edge and the white matter in the middle, and it consists of these tracks sending information throughout the brain. So we've done group studies, and we've looked at both the grey matter and the white matter. So what you do to make pictures like this is you take a group of patients with PSP, their MR scans, and you take a group of MR scans from patients that do not have PSP, and you compare them, and we have these statistical packages that compare them for us. At every point in the MR image, they're compared to see is there brain shrinkage at that point in the brain MR scan. And then you get a map like this. So again, I've shown it on a 3D render of the brain. This is a side view, this is the front of the brain. This is the medial view again, looking on down the middle of the brain. This is the top view, and this is the bottom view, as if you were looking up at somebody's brain. And then I've shown any kind of abnormalities or where the program says the brain has shrunk in the white matter is in green, and regions where the grey matter has shrunk is in red. So the first thing to notice is we see the brainstem light up. So we expect that. We've seen the midbrain atrophy. I've shown you on individual scans, and this is the midbrain here. So we see white matter, particularly white matter involvement of the brainstem. The superior cerebellar peduncles, the little tracks that I've shown you, are right here. They basically connect the cerebellum up through the brainstem to take information to the rest of the brain. The second thing to notice is this picture is mainly green. So we see a lot of loss or degeneration in the white matter tracks of the brain in PSP. We do see a little bit of grey, loss of the grey matter, and it's usually up here in the frontal lobes. And you can actually see quite a nice sort of almost progression through the brain in these sorts of images. You can really see the degeneration down here in the brainstem and then going up and causing a little bit of grey matter loss in the frontal lobes. So we see loss of the frontal lobes in the brainstem, but really predominantly in the white matter, these tracks that are connecting parts of the brain and sending information. This is a couple of FDG PET scans. So you saw some of these from Dr. Bouvet. So again, here we're looking at energy metabolism in the brain. How well is the tissue working? And this is two scans from two patients. So we've got lateral views of the brain. This is the front, this is the back, again, as if you're looking through the side of the head. And these are the medial, so through the middle, the top and the bottom view. And regions that are bright are the regions that are showing abnormalities in each of the patients. So one thing we notice, we do quite often see a bright spot where the midbrain is. So we've lost tissue there, but we're also, the tissue that's there isn't performing as well. And that's here. And we sometimes call that the pimple sign. It looks like a little pimple in the brain when you see it there. It's not as commonly there as on the MR. The MR performs much better to see abnormalities in the midbrain. But we also see abnormalities in the brain tissue in the frontal regions too. And this just shows two examples that you see variability across subjects. This subject has more involvement of the frontal lobes than this subject, but they both have a similar abnormality in the midbrain. So that's PSP. What about corticobasal syndrome? Well, we see something quite different typically in corticobasal syndrome. So here, instead of the abnormalities being in the brainstem structures that we saw on those images, here we see the abnormalities in the cortical regions of the brain. So again, here's our render of the brain looking through the side of someone's head. And this is a healthy brain shown at about where I've got this red line here. So this is the healthy brain tissue. And if you look first at the healthy brain tissue, you can see that the brain is quite full. So the dark areas around the tissue here is fluid-filled spaces that surround the brain and that are always there. But you can see there isn't too much dark around this brain. The tissue itself, these are called gyri, are quite plump and they take up the space inside inside the skull. But when you start to see atrophy or shrinkage of this brain tissue, you see thinner bits of brain and you see more black. So that's more fluid around the brain, which is taking up the space that tissue used to be. So here you can see atrophy or loss of tissue here and quite severely here. And we see in corticobasal syndrome, we typically see this shrinkage of the brain in the frontal lobes and also at the parietal lobes, sort of these regions here, and I'll show you some maps of that. And we often see that it's asymmetric, and that means it's worse in one side of the brain than the other, and that tends to match the fact that the clinical symptoms can be asymmetric. So if you had abnormalities in the right arm, you might see neuroimaging abnormalities in the left brain, because we have a crossing of white matter tracks. So it's the opposite side to where you see the abnormality clinically. So this patient has abnormalities on the left, and this one on the right, but in similar regions of the brain. So again, we've done group studies. We've taken a group of MR scans from patients with corticobasal syndrome and compared them to healthy controls. And we've looked at both the white matter, which is in the green on the images, and the grey matter shown in red. So you can see the brunt of the degeneration is up here in what we call the cortex. So it's not here in the brainstem, which is what we saw in PSP. It's up here. It's asymmetric, and we also see much more involvement of the grey matter, meaning there's more red on these pictures than there were in the pictures of PSP. We still see white matter involvement, so some damage to the tracts, but a lot of more involvement of the grey matter. And this is an FTG scan from a patient with corticobasal syndrome, and you see a similar pattern here of abnormalities. So it's posterior frontal and little involvement of what we call the parietal lobes here, but it matches quite well with the render, where we're seeing the abnormalities. So then we can see, well, how does the map that we see in corticobasal syndrome compare to the map that we see in PSP, the brain map? So I've shown basically the same two maps that you've already seen. Over here is the map of where the shrinkage is in PSP. So we see the brainstem and a lot of green, so a lot of the white matter. And here is corticobasal syndrome, so we don't see the involvement of the brainstem, but we see more involvement up here in cortical regions, and it's more red. So more involvement of the grey matter, less involvement of the white matter. An interesting thing is that we do see some patients that have symptoms of both PSP and corticobasal syndrome. So we looked at the imaging features of those patients as well, and we found that they tend to, at a group level, this is a group comparison, tend to show imaging features of both PSP and corticobasal syndrome. So they're shown in the middle here. So you can see these patients have their involvement of the brainstem, that's the PSP features, and they have the grey matter involvement in the cortical regions, which is the corticobasal syndrome features coming in. So they're really showing evidence of both. And that again shows how well what we see on the imaging matches with what's happening to the patient. So next I want to talk a little bit about tracking progression. So what I mean here is we take multiple MR scans every year for a number of years to see what's happening to the brain. So this was a study we did quite a while ago, back in 2006, looking at 6 patients that had PSP. And we wanted to know how is the brain changing over time. Here we actually measured the whole brain volume. So we took the whole brain, like I've shown you on those 3D renders, and we used a software program to outline the whole brain and say what's the size of the brain. And then we looked to see what happened to that size over time in these 6 patients. And you can see that everybody is gradually declining. The brain volume is gradually shrinking over time in all 6 of the patients. This just provides a kind of a map of perhaps where some of these changes over time and where some of these changes are occurring. So there's 4 MR scans from a patient with PSP from 1998, 99, 2000 and 2001. And in red are the regions where the tissue has been lost. So you can see that we've lost tissue here. These are fluid-filled spaces in the brain that tend to enlarge as the brain shrinks around the edge of the brain. And then as the disease progresses, you see a lot of involvement here of the brainstem. And you've seen this same slide before, but I thought I'll show it again just to reinforce it to you. We followed up the early study by looking at more patients with PSP that came into a study that we ran a number of years ago. And we followed patients and we scanned them every 6 months for 2 years with an MR scan. So what you're seeing here for whole brain, which is the size of the whole entire brain, and then the size of this midbrain structure. And the black lines are individual people, and this is the size here, and the disease duration, so how long they'd had the disease. And as we saw in our smaller study, we did see that patients, both the midbrain and the whole brain, are declining over time. And we actually see particularly strong declines in the midbrain volume over time. And we actually also looked at the clinical decline in these patients over the same time interval. And we found that the rate that the midbrain was changing, so how much that midbrain changes from 1 year to the next, correlates really well with the decline in disease severity, so the PSP-RS. So again, it's really linking really quite well to what's happening to the patient. And this is important because if you wanted to use imaging in a clinical trial, you want to make sure that your imaging measure, which could be a midbrain area, midbrain volume, it means something clinically. So if you can give a patient a treatment and slow the decline in the midbrain, the assumption would be that would also help clinically, because there's a pretty tight link between what's happening to this structure and what's happening to the patient. So this is another study where we looked at rate of the whole brain loss in PSP, but also in corticobasal syndrome. So what we've got here is the rate that the whole brain is declining, and if it goes down from this line here, then that means shrinkage of the brain. And then we had a number of different diseases that we looked at in this study. The main point of this is, as I've shown you, the PSP subjects the brain was declining over time, and we actually found that the rate was quite similar to some other diseases, such as Alzheimer's disease. But we also found similar declines in the patients with corticobasal syndrome. In other words, we're seeing progressive loss of the brain tissue. We actually see faster rates in this study, at least, in a small group of corticobasal syndrome patients than the PSP patients. And I think the only reason for that is that we are seeing involvement of the different brain regions in corticobasal syndrome. So we saw on the maps that it particularly involves the cortex, and that contributes a lot to our whole brain measurement. So I don't think it's particularly any correlation with how the corticobasal syndrome patients might be progressing clinically, but more how what our measurement's picking up, because corticobasal syndrome really does involve the cortical regions. So kind of a summary from the neurodegeneration. So one of the most useful MR features we see in PSP is the midbrain atrophy. So I've shown you what it looks like. It really does help differentiate PSP from other diseases such as Parkinson's disease and MSA. And it correlates really well with what's happening clinically in the patients. We've also shown that there's a lot of involvement of the white matter, these tracks that send information in the brain in PSP. And again, that correlates well with what's happening with the patient. PSP and corticobasal syndrome show some overlapping features, but CBS really shows more involvement of the cortex, the top part of the brain, and less involvement of the brainstem. And we can measure change in brain structure over time in both PSP and CBS and detect declines over 1 year and I think probably over 6 months as well in patients with both diseases. So I just want to also talk to you a little bit about the tau PET imaging that Dr. Bové introduced earlier. So we now have a type of PET scan that can detect these tau proteins in the brain. So it's a bit like an FDG PET scan in that a patient receives an injection of a tracer and then is scanned in a PET scanner. So this type of technology, these tau PET scans, were originally developed for the type of tau that we see in Alzheimer's disease. But the big hope was that it would also be useful in PSP and corticobasal syndrome, because both of these diseases have tau proteins in the brain. It's still a very recent development. I think we're still learning a lot about these scans, but it's not looking as hopeful as we hoped, but I'll show you what we found so far. And I think I just want to stress also, why do we want to be able to detect tau in the brain? Well then, firstly, it can really help in diagnosis. If you can see that those abnormal proteins are there during life, you don't have to wait for an autopsy to see the proteins to help in diagnosis. And also for clinical trials, if we had a measure of the actual protein, then when you give a treatment to the patient, you can actually look to see what's happening to the thing you're trying to target. So it's really, really valuable, and we really would like for tau PET to be working in the future. So what do we see in PSP? So at the top, I've shown you a tau PET scan in a healthy control. So here, and at the bottom is one of our patients with PSP. So the healthy control, this is read as a completely normal tau PET scan. So it's kind of bluish in colour with just a few areas of very light green. What you're looking for on these scans is bright colours, so yellow and red. So this is a normal tau PET scan. And then in the patient with PSP, you are starting to see some areas that look more abnormal, suggesting what we hope they might be telling us there could be tau proteins there. So here we see some very this uptake in very characteristic regions. And there have been a number of studies that have looked at tau PET, probably about 5, 6, and we've all found really the same regions that we see this tracer showing a signal. And these are the regions. So we see a region in the cerebellum. It's actually called the dentate nucleus of the cerebellum. Down here, we see a bright spot in the midbrain, so this structure that we've been looking at on MR. And we also see a bright spot in sort of some deep grey matter structures that are deep in the brain that we call the basal ganglia, which can also be abnormal on MR in PSP. So this is the characteristic pattern that we're seeing, although there's a lot of variability across patients. When we do a group study, so it's a bit like when we did the MR group study, we take a group of tau PET scans from patients with PSP and compare them to a group of healthy controlled tau PET scans. And here we're looking for the bright areas showing at a group level where are the abnormalities on the tau PET scan. And they're in the same regions that I showed you in the individual patient. So this is these are all slices through the brain as if you're looking at the patient. This is at the back of the brain where we see the cerebellum. And then we see the midbrain, which you can also see here. And here, this is the view that you're more used to looking at for the midbrain. And then these basal ganglia structures. So it holds up in a group study. But we are seeing a lot of variability at the individual level, so it's not to the point where we could look at a scan and be really confident that that is a patient with PSP. So that's one of the problems we're facing. And that's kind of shown here. I wanted to show you the difference between what a tau PET scan looks like in PSP and what a tau PET scan looks like in Alzheimer's disease. So remember, this technology was developed for Alzheimer's disease, so it does a really good job in Alzheimer's disease. This is an Alzheimer's disease patient at the bottom. And you can see how much signal we get in the Alzheimer's patient. It's bright red, it's throughout the whole of the brain. And we just do not see that amount of signal in the PSP patients. There could be a number of reasons for that. It could be a problem with the technology. It could be telling us something biological, that there may be less tau protein than in Alzheimer's disease, but we're still at the point where we don't know, and we're still investigating it. We're kind of hoping it's telling us something, but the fear is it might not be. It might be just binding to something that really it's not binding to tau. It could be binding to something else. We don't know. So we're still at a very early stage of investigating this. But I just wanted to point out that difference. So we've been doing tau PET scans over time. So we have patients come back yearly and have another tau PET scan, because another question is, well, we see this signal, but what's happening to it over time? Does it correlate with what's happening to the patient like the MR does? So the first question we had was, well, is it increasing over time? Because you might expect that the tau proteins in the brain are getting worse over time, and that's why the patient's getting worse. So are we seeing that on the scan? Well, the answer is sort of sometimes. Of 9 patients that we looked at, the tau signal did increase, and here's some examples here of it increasing over time. It did increase in maybe 6 of them, not by massive increases, just subtle increases, but it didn't increase in 3 of them and actually went down. So again, that could be just a method thing, not telling us anything about the actual disease. And we also found that what was happening on the tau PET isn't correlating at all to what's happening with the patient, how the patient is getting worse over the year. So this is all pointing to not such a good biomarker. It's not such a good marker of the disease as of yet in PSP. In contrast, when we looked at midbrain volume, or the area of that midbrain, in these same people, that changed a lot over the time interval and did correlate with what was happening to the patient. So everything's pointing to, at the moment, still MR. MR and midbrain volume is a better marker of the disease than the tau PET at this point. Well, what about corticobasal syndrome? We've also done some tau PET scanning in corticobasal syndrome patients, and I've shown 3 patients here. These are what we call axial slices through the brain. So if you're looking down at the top of the patient, this is the front of the brain and this is the back of the brain in each of these pictures. And so a few things to notice here, that it's very variable. So we have 3 patients. This patient shows quite a lot of signal from the tau PET scans in these regions of the brain, which are sort of premotor motor regions of the brain. This patient has a little, and this patient doesn't have any at all. What we can say is it looks very different from PSP. We're not seeing the same regions that we see in PSP, but it's very variable. As of yet, we don't know if what's happening here is really relating too much to what's happening to the patient, and we also don't really quite yet understand what's happening with this ligand, but we're still investigating it. I think that's the key. It's still early days. We're still going to investigate it, and also other types of tau PET scan that might prove to be better in PSP and CBS that come along. We're going to investigate those too and see if we can find one that does give us a clear signal and correlates with what's happening to the patient. So what has neuroimaging taught us that I've been talking today? I think it provides invaluable information on what is happening in the brain in PSP and corticobasal syndrome. I think we've learned things. We've learned that there's a lot of degeneration of the white matter in PSP. We know the characteristic features to look out for on the scans of PSP and corticobasal syndrome patients. We see distinctive patterns that can be helpful in diagnosis just to help corroborate the clinical diagnosis. We can measure change, and this is important to measure how fast the brain is changing. So when we do have a treatment, we can give the treatments to patients and hopefully show, as Dr. Bavay nicely demonstrated, that rate of how the brain's shrinking is slowing. That's what we want to see. We want to see it slowing. And it's very early days, but I think we have the potential now to detect abnormal proteins using imaging, particularly helpful in Alzheimer's disease, but I think research will take us closer to getting something that's going to work in PSP and corticobasal syndrome. So in the last minute or so, I just wanted to tell you a little more about the study that we're running here at Mayo. So it's a National Institutes of Health funded study on PSP. We started in 2015 and it'll end in 2020. And it's led by myself and Dr. Keith Josephs. Our study coordinator is Sarah Boland, who is in the back. Sarah, give a wave again. So the aim of our study is to investigate tau PET imaging. So that's our big focus, is understanding the tau PET imaging in PSP, looking at over time and determining whether it's related to clinical outcomes. Could it be a marker that's used in clinical trials? We're really trying to learn about this particular type of imaging. We plan to recruit 84 patients with PSP. We've already recruited 52, but we still have more patients that we would like to recruit. All patients undergo 2 research visits, so we have patients come in once and then once again after a year, so we can look at change over time. All patients undergo a clinical assessment that's been specifically targeted to PSP, and that will include a visit with Dr. Josephs or Dr. Botha that also works on the grant. Everybody will get an MR at both visits and a tau PET at both visits. And also we're starting to look at swallowing in patients with PSP. And so everybody that comes into the study will have an investigation of their swallowing abnormalities by Dr. Clark, and you'll be hearing from her later today. And we pay for all of these investigations that patients have as part of our study. So I just wanted to leave you with our contact information for Sarah. This is her phone number, and our study is also on clinicaltrials.gov that you've been hearing about. And I wanted to say thank you to all our research participants, because without patients coming in for us and going through this imaging, we wouldn't be learning so much about the disease. So thank you.
Yeah. My wife has PSP, has fallen at least a dozen times and had head trauma. She's hit her head almost every time because she can't react back.
Right.
In this particular study, are you taking into account the effects of CTE in terms of the clinical outcome and what's happening with the patient?
We're not, in more for the fact that it's very hard to determine that it's CTE on the tau PET scan. No, unfortunately, but we would be keeping track of anything like that happens to the patients, but we don't have any specific aims to do that. And it's a little early on with the tau PET to understand, what we might see if a patient had fallen and had developed some CTE through that. We haven't seen it yet, so yeah.
Is CTE diagnosed with a different kind of imaging?
I was not diagnosed with imaging as far as I know at the moment, no. It's diagnosed at autopsy, I think. It's chronic traumatic encephalopathy. Yeah, so there's been a lot of interest with the NFL players and having a lot of hits on the head, developing some tau proteins in the brain. And I'm sure there are studies that are going on looking at tau PET imaging in those, but I haven't done anything with that. So.
Yeah, so curious, are you making the correlation that with the presence of the tau protein that actually is causing the volume decrease?
That's what we would like to be able to do. Yeah, if we could be confident that the tau PET scan is telling us that there's tau there, and that's what we're still not completely sure about in PSP and CBS, then that's exactly what we want to do. We want to know, is the tau directly causing the loss of volume? We think it probably is, and we've done some studies on some autopsy cases that have died, and we've looked at the tissue and looked at volume, and we think that the tau is directly related to the volume loss, and we would love to be able to test that on the tau, but we're using the tau PET imaging, but we're just not quite there yet.
What does the deterioration of the gray matter versus the white matter mean?
That's a good question. That's a very good question. But I think it teaches us about the disease mechanism. So if we understand that the white matter is showing a lot of involvement, then that tells us something about how the disease might be spreading through the brain. Because you have these tracts that connect parts of the brain. And if the primary problem is in the tract, then that could be telling us something about why the tissue is being degenerated. So it tells us the mechanism is more from the tract to the tissue versus perhaps the abnormalities is more in the tissue leading to degeneration in the tract. So it's really at the moment sort of giving us more information about the biology of the disease. I don't think it's telling us anything that could help with biomarkers, perhaps. I mean, one thing it's telling us in PSP is that if you wanted to get a measurement that you could use in a clinical trial, then perhaps look at these white matter parts of the brain to get that measurement, as opposed to the grey matter region. So it's helping to maybe guide how we look at the imaging, how we might use it for clinical trials, and teaching us something about the underlying biology to help us understand how it's all working. Because if you can understand how it's progressing through the brain, then you might be in a better position to find a treatment that targets the right thing to stop it. Can that help?
If a person wants to help and try to find new things for people, do you have websites?
So the studies on the clinicaltrials.gov website, so this website down here, that you could go on and search for PSP. I'm not sure, can you search by your name, Sarah? I'm not sure if that's possible. But you could also email, sorry, I didn't put the email there, the phone, you could ring Sarah or speak to Sarah, she's at the back there, if you would be interested in participating. But the website is really just the clinicaltrials.gov website that you could find it on.
We're not sure on that question on if they can search under Sarah's name.
Oh, maybe just search by the disease and it'll come up. We don't cover travel costs, so that's one thing that's really difficult, I know, for patients and families. We cover the cost of all the things that happen when the patient's here, the MR, the tau PET, the clinical assessments, but not the travel or the hotel, unfortunately. I think we're ready to move on.
Dr. Whitwell, thank you so much.
Thank you.